Welcome to Session 6, VIA Screening, Evaluation, and Emerging Technologies. Here we will take an in-depth and more detailed look on how to conduct VIA screening, the evaluation of VIA, and of course emerging technology. So let's start by watching this video. How to conduct a step-by-step visual inspection with acetic acid.
Before you start any screening, it is important that you reassure your patient by explaining why the screening is necessary. You should discuss the procedure and explain each step. You should advise the woman that she may feel some discomfort and that there may be some mild side effects from the procedure. First, you need to prepare your equipment and examination room. You'll need a light source, cotton swabs on a stick, a small container, 5% vinegar or acetic acid, gloves and a speculum. 5% acetic acid is prepared by adding 5 ml of glacial acetic acid into 95 ml of distilled water. If you are using vinegar bought from a store, then make sure the vinegar is labelled as 5%. Ideally, the brand should also be tested by a laboratory to check it is actually 5%. You'll need to make sure that all the equipment you use has been properly decontaminated and disinfected. Once you have the equipment and examination room ready, you can have the woman get into position while you wash your hands and put on your gloves. The woman will need to lie on an examination table or bed in the lithotomy position, with her legs open and her knees supported. If leg supports are not available, a chair can be used to support her legs by putting her feet on the edge of the chair. Before you insert the speculum, you should first examine the external genitalia and perineal region for any signs of sexually transmitted diseases or abrasions. Then insert the speculum gently into the vagina. You do this by holding the speculum blades together and slipping them into the vagina. Be careful not to press on the urethra or clitoris because these areas are very sensitive. Gently open the blades and look for the cervix. Move the speculum slowly and gently until you can see the entire cervix. Lock the speculum in the open position so it will stay in place.
Upon visualizing the cervix and prior application of acetic acid, here are some of the changes that you need to take note immediately after the placement of the vaginal speculum and upon seeing the cervix and prior na application of acetic acid. So here are normal and abnormal changes that you need to check. First is the vaginal discharge. If you have a clear vaginal discharge, then likely this patient is already on her follicular phase. Ito yung prior ovulation na phase. Now, if that becomes thick, like in this case, mapapansin nyo, there is a thick discharge, so that's again a normal phase. It's on the luteal phase, so more on progesterone, more on nag-ovulate na yung patient mo. Okay? Sometimes, meron tayong tinatawag na this can also be seen during pregnancy minsan, yung tinatawag nilang copious, copious is parang dura ng dura, labas ng labas, parang ganun, And then others can be described as tenacious, makikita mo parang nahuhulog na hindi mo matanggal-tanggal normally during cotton, placement, and then parang bagging, yung kung saan nagkukon si Tarzan, yung na ganun, nagfo-fall out coming from the external os, So those are normal thing, Another normal thing that you can find is the Nabothian cyst. These are sometimes pearl white or yellowish, These are harmless bumps that are formed when the skin cells clog glands in the cervix, Under abnormal vaginal discharge is bacterial vaginosis, no? These are excessive gray, white, or yellowish discharge with a fishy odor. Another is candidiasis, no? Or fungal infection. These are thick or thin, curdy, white discharge. These are another images of candidiasis. Trichomoniasis, however, are profuse, greenish, yellow, frothy discharge. On certain occasions, you might be able to see trichomoniasis where there is pus or nana, no, coming out of the external os, no. You may want also to check on the urethra. If there is such, then maybe this patient is suffering from gonorrhea or chlamydia, no. Another picture of trichomoniasis is what we call as the strawberry appearance of the cervix, no, as it is shown in the image. In some cases, there are severe cervicovaginal infections, no, or inflammatory changes in the cervix, no, that can lead to desquamation. Ibig sabihin, nagpipil, no? So, pag tinanggal mo yung puti-puti na yan, sometimes makikita mo, there are what you call as erosions. No? These are because of cervical vaginal infections, no? And yan, nakikita nyo, nagbi-bleed. Another that you may find are cervical polyps. These are outgrowth from the endocervix na lumabas dyan sa labas para silang sumisilip. Akala nyo maliit lang, no? There are cases na malaki yung polyp. And there are some cases also, no, na kung saan na yung polyp, short lang yung stalk na parang hindi gumagalaw. Kasi in most of our experiences, nakikita natin our polyps are gumagalaw. Pero in some cases, pag short ang stalk, they are immovable. Some of them even have necrosis, na necrotic ang itsura. Akala mo tuloy these are cancer already. Yan. And some are ito yung tinatawag nating leukoplakia. Now, these are well-demarcated white, visible on the cervix even before the application of acetic acid. And that is one of the reasons why dito kami, no, kapag nagpapa-screening kami, we take a photo of the cervix prior the application of acetic acid. Kasi minsan, yung nakikita naming puti is leukoplakia. That is due to a deposit of keratin. Ang cause niyan is sometimes idiopathic, meaning to say, hindi namin alam kung what is the cause. Some of which are chronic irritation, kung nalalaglag yung cervix mo minsan, gasgas, no? Sometimes there are cases na gano'n. Or in some cases, possibly that is due to HPV. Another image of leukoplakia is this also, no? Para at least makita nyo talaga. Now, another is cervical condyloma. A condyloma is a genital wart and a genital wart, alam nyo, is a benign condition. Kung mapapansin mo, this is an HPV cause pero low risk. Ito parang somewhat similar din ito sa CIN, no, yung ating via positive, no. However, ito kadalasan, no, some are bago pa lang, no. Pagbukas mo pa lang, paglagay mo pa lang ng speculum, makikita mo nang namumuti, no. So sometimes it can be misdiagnosed as parang via positive pero hindi ka pa naglalagay, no. Pero there are cases na kung saan nakikita mo yung puti after the application of acetic acid. Ito makikita mo parang island siya, in those in red. And sometimes you have to also understand kung nasaan ba ang location nito. Kung ito ba ay nasa within the transformation zone. Paano mo alam kung nasa transformation zone? Hanapin mo yung mga Nabothian cyst mo or yung endocervical crypts mo, no? Kasi yun ang transformation zone. And then some others are within the transformation zone. So again, these are very hard to distinguish visually with your via positive. Yan. And then more pictures, no. Some are even grabe, no? Parang ang thick lumalabas. Akala mo talaga parang high grade na CIN, pero in reality, this is condyloma. So, how do you differentiate? Visually, mahirap, no? I really have to admit. What you can do is if you do a HPV DNA testing, high risk lang ang tinetest doon eh, no? So lalabas doon it will become a HPV high risk negative 'yon. Now, sometimes you also can see ulcerations, no? Hindi yan erosions, ulcer na yan, ulcerations. Or sometimes you can even see growth. This is very typical for early cervical cancer. These are abnormal na. Normally, hindi na namumuti yan, no? These are suspicious na for cervical pathology. And these are cases of advanced cervical cancer, and nakikita mo exophytic na lumalabas na, no? Or ulceroproliferative. May ulceration, merong proliferation, iba-iba na. And may mga ulcer, at the same time merong growth, no? Sometimes sa mga to, you don't expect them to highlight pag naglagay sila ng acetic acid eh. Yung mga ganitong cases, maganda yan for biopsy na para malaman natin, no? Again, you can see ulcerative growth as shown in the image.
If there are secretions on the cervix, gently wipe them off with a cotton swab. Using a new cotton swab, next you need to apply the 5% vinegar or acetic acid to the cervix. You do this by the gentle but firm application of a cotton swab soaked in the vinegar or the acetic acid, and you apply that directly onto the surface of the cervix. It is important to note the time. You should leave the cotton swab resting on the cervix for 1 full minute. Immediately after removing the swab, observe the cervix for any white lesions. If you see any, observe the time again and start timing, as you will want to be sure a lesion is still there after 1 minute. If it is not there after 1 minute, it is more likely to be squamous metaplasia and not pre-cancer. A pre-cancer lesion will stay distinctly white. This is called acetowhite and will occur within the transformation zone. It will have clear borders and it starts at the squamocolumnar junction, or SCJ. The SCJ is the intersection between the endocervix and the ectocervix and is where abnormalities start. Normal cells remain pink after applying the acetic acid. When you're observing the cervix, you should ask yourself the following questions. Is it suspicious for cancer? Do I see a VIA positive lesion? Can I see the entire SCJ? If not, then you may not be able to get an accurate result. Other questions to ask are, what is the location of the lesion? Is it in, near, or far away from the SCJ? Does it extend into the cervical canal? Does it involve the entire cervix or extend beyond the surface of the cervix? If the answer to either of the last two questions is yes, then the woman may not be eligible for cryotherapy and will need to be referred for further treatment. Once you have finished your observations, withdraw the speculum gently. You should then dispose of all contaminated swabs, gauze and other waste material into a plastic bag, in a plastic bucket or a clinical waste bin. Gloves should be decontaminated by soaking in 0.5% chlorine. It is also important that you wipe down any surfaces that may have been contaminated with blood or body fluids with chlorine solution. The floor should also be cleaned daily. You will also need to make sure that your equipment has been properly decontaminated and disinfected before your next patient. You do this by fully submerging the speculum and other instruments in a plastic container filled with 0.5% chlorine solution for 10 minutes. 0.5% chlorine is made up of 1 part 3.5% bleach to 6 parts water. Scrub the speculum afterwards in clean water and detergent and then rinse thoroughly. Carry out a high-level disinfection by soaking the instruments again in 0.5% chlorine for 10 to 20 minutes. If they're left longer than this, they may begin to corrode. Rinse again with clean water and allow to air dry and cover with a clean cloth. Alternatively, you can boil equipment in water for 30 minutes. If boiling water is used, the speculum should be left to cool at room temperature before use. These procedures will greatly reduce the risk of transmitting infection to the patient.
Will the observations tell me if the test is positive or negative for precancer?
Yes, your observations will tell you if the test is positive or negative for precancer, but not for cancer. However, during your observations, it is sometimes possible that you may see a lesion that is suspicious for cancer.
Can you tell me what positive and negative results look like?
This is a normal cervix and it has been given a negative result. Notice that it has a healthy pink colour, clear mucus coming from the cervical os, and no aceto-white areas seen at all after VIA. This is a precancerous cervix. You will notice that it is reddish in colour. The aceto-white changes are quite clearly demarcated. The opaque aceto-white areas, which are well demonstrated here at the squamocolumnar junction, indicates this is a VIA positive cervix.
We're now going to ask you to identify some positive and negative results. You have 10 seconds to answer before being given the correct information.
What should we do after the examination?
Depending on what you have observed during VIA or VILI, you may need to refer the woman for further investigation or treatment. A woman with a positive lesion should be treated that day with cryotherapy if possible. It may also be necessary to carry out further investigations such as a colposcopy and biopsy. A woman with a lesion suspicious for cancer should be referred to the closest referral site for diagnosis and treatment. Remember, it is important to reassure the patient and inform them about further treatment or side effects following the procedure.
In the application of acetic acid, there are other schools who are not favoring the application or the use of the cotton tip. Others use cotton balls instead. They prefer that. So in this case, this is coming from the International Agency of Research on Cancer. They are more advocating the use of cotton balls and a generous amount of acetic acid when placed on the cervix. What they recommend is the up-down motion bathing the cervix. So you put the cotton swab on the squamous epithelium on the anterior lip, and then you push it so the acetic acid goes down, and there will be pooling of acetic acid down at the bottom of the speculum. You get it up again, the acetic acid on the bottom of the posterior lip, and then put it again on top. So you continue that up down motion, dabbing on the anterior lip and back for 1 minute. In most cases, when you first open the cervix, you can note the presence of mucus normally before the application of acetic acid. Remember, acetic acid is the one that dissolves the mucus that is present on the surface to clearly see the cervix. Another advice is that please do not rub using the cotton ball on the cervix, especially on the columnar epithelial part, because the surface epithelium can easily get peeled off and the reading of this becomes more difficult. In this case, as you can see in the image, leads to the exposure of the underlying stroma or erosion and bleeding. Sometimes it even obscures, if you can see that white part there, the bleeding obscures the aceto-white so that it becomes difficult for the reader to interpret this image. After the application of acetic acid for 1 minute, you now proceed to interpret the changes on the cervical epithelium. This is 1 minute after the application of acetic acid. Bakit? Kasi normally yung mga makikita mong namumuti within the less than 1 minute, no, within the 20 to the 30 seconds, which later on fades away, these are metaplasia lang, no? So they are still aceto-white but they are via negative. So remember, wag kayong judgmental. Hindi lahat ng makita nyong mamuti, isipin nyo agad via positive. Hindi lahat ng makita nyo na dinudugo, automatically suspicious for carcinoma na. After placing the acetic acid for 1 minute, it is now time to interpret the changes on the cervical epithelium. Normally, it is done 1 minute after the application of acetic acid. Hindi agad-agad kasi normally, yung lumalabas na 20 to 30 seconds are metaplasia. This is the time taken for coagulation of any cellular proteins in the epithelium which give rise to aceto-white. So again, 1 minute after the application of the acetic acid. So just to clarify, acetic acid is placed 1 minute on the cervix and interpretation is after 1 minute of the removal of the acetic acid, yung cotton balls na nilagay na nakapahid sa cervix. So in here, you need to define the anatomy of the cervix. You need to know where is the SCJ. When we're always referring to the SCJ, now we are actually referring to the new SCJ, hindi na yung old, okay? You also have to identify yung transformational zone, no? Because that is where most of the cancers or the precancers are. Once now you identify the SCJ and the transformational zone, try to find if there is a aceto-white in the area. Exclude benign aceto-white area. Aceto-white area, in this case, this line-like, no, appears near the endocervix at the lower edge of the SCJ. This is normal because that is immature metaplasia. And metaplasia normally appears aceto-white upon staining with acetic acid. Exclude also the aceto-white dot-like located in the endocervix because you have to remember columnar cells with metaplasia appears aceto-white as well. Furthermore, you have to exclude other benign conditions which we have mentioned earlier, like in this case, Nabothian cyst colored yellow, and of course, endocervical polyp on your right. So now you have done your part, you've identified the anatomy, and found out an aceto-white. It's now time for you to interpret whether that aceto-white is via positive or via negative. Again, lagi niyong tandaan, no, na hindi lahat na nagwa-white doon sa transformational zone via positive, no. At this time, I would want you to meet, no, Mr. Liz, no. Bakit si Mr. Liz? Kasi yan, nagpapautang yan, no? Naglilista yan ng mga utang. Kasi, pag hindi ka nagbayad ng utang, no, sa kanya, aalisin ka niya dito sa mundong ibabaw. Now, actually, Mr. Liz is an acronym na para tandaan ninyong madali yung pagbabasa ng aceto-white whether this is positive or negative. Now, M stands for margin, okay? R stands for rapidity on onset of aceto-white. L stands for location at saka number ng patches. I stands for intensity of color. S stands for size. And another S stands for surface. Yan. Now, as far as margin is concerned, there are differentiating key features between via negative and via positive. Diffuse or indistinct are features of via negative. Sharp and irregular, especially the feathery, yung angular, yung digitating, yung geographical, these are again via negative. Sharp and regular are again via negative. Ang via positive ay ito yung sharp and raised. Mali yan. Sharp and raised. Sharp yung edges at nakaangat. We will show you now some images na via negative and via positive.
M for margins of the acetoid and the cervix may appear as a diffuse margin. Margins are indistinct in the blue arrow. This one is feathery. This is angular in blue and feathery in yellow. This is sharp and digitating margin. This one is sharp and flat margin. This is a raised margin.
As per rapidity on onset of aceto-white, if the aceto-white is shown slowly over 20 to 30 seconds or it fades quickly, then kadalasan, malamang, these are via negative. However, if yung aceto-white appeared immediately, rapidly, and then it still persisted even after 1 minute after mong nilagay yung acetic acid, then those are via positive.
R for rapidity of onset of acetoid area. So this is before application of acetic acid. This is after application of acetic acid. And acetoid area appears slowly over 20 to 30 seconds and it fades away quickly because this may indicate metaplasia, inflammation, or even low-grade precancer. A high-grade lesion before the application of acetic acid. After application of acetic acid, there is the dense acetoid that appears rapidly within 18 seconds.
Location naman, via negative kapag ito ay within the transformation zone at attached to the SCJ or yung mga tinatawag nating outside the Colombo or outside the transformational zone. Those naman within close to the transformational zone or close to the external os are via positive. Here are examples.
L for location, and that acetoid is within the transformation zone or attached to the SCJ on both the anterior and posterior lips. And these are VIA positive, which turn out to be CIN. Location of acetoid is within the transformation zone, extending into the endocervical canal, and this is VIA positive. Acetoid is located within the TZ on the anterior lip, extending into the endocervical canal, which is a VIA positive, and biopsy result is CIN. Acetoid is located in the TZ on both anterior and posterior lips. That is attached to the SCJ. And the yellow one is a acetoid that is a satellite lesion that is detached from the SCJ.
As far as the intensity of colors, thin, transparent white, or milky white is a feature of via negative. On the other hand, kapag ito ay makapal, dense, opaque, talagang hindi kita, hindi see-through, hindi transparent, dull, or oyster white, these are suspicious of via positive. Here are examples.
Intensity is described as thin or dense. Thin if it is transparent or milky white, and it is dense when it is opaque, dull, or oyster white. So that will depend on the intensity. In here, it's thin on the anterior lip with irregular feathery margin, which is a VIA negative. This is a dense acetowhite or opaque white epithelium, which is a VIA positive, indicative of high-grade CIN.
On the part of the size, we need to identify the extent of the quadrant. The cervix will be divided into 4 quadrants.
S for size and divide the cervix into 4 quadrants and indicate which quadrant is affected. Quadrants 1 and 2 are affected in this case. Acetowhite on quadrants 1 and 2, which is VIA positive. All 4 quadrants are affected by acetowhitening.
And lastly, surface. If the surface of the acetowhite is smooth or pitted, yung parang brain-like, no? Most likely these are VIA negative. On the other hand, if these are large with irregular surfaces, then most likely these are VIA positive.
Second S is for surface, and in this picture, green one is a pitted surface appearance, while the cyan blue has a smooth surface. Surface here has a brain-like texture, which may indicate condyloma of the cervix. Surface is irregular with dense acetowhite area, which is a VIA suspicious of invasive cancer. Here is the summary of findings of acetowhitening with M. Margin, R is rapidity, L is location, I intensity, the size, and the surface. All the red one may indicate a VIA positive. Documentation is an important part of the procedure. Documentation of findings includes the visibility of the SCJ, the outcome of the VIA, whether that is negative, positive, or suspicious of invasive cancer, and if that turned out to be positive, you should indicate the number of quadrants that are affected or the percentage of cervix that is involved. And lastly is the plan of management. Now, you can record it this way. How do we interpret? Either negative, positive, or suspicious. Subsequent slides are VIA negative. Columnar epithelium that appears white after acetic acid is called blanching, and this is considered as VIA negative. White color that fades away after a few seconds is also VIA negative. This polyp prior to acetic acid. With faint acetowhite color is also VIA negative. Indistinct transparent acetowhite patches on columnar epithelium is considered as a VIA negative. Same with the appearance of the columnar epithelium, which is VIA negative. VIA positive are distinct, dense, opaque acetowhite areas in the TZ that is close or attached to the SCJ. The margins are usually well defined or either flat or raised from the surface. Dense acetowhite at the TZ with a distinct and sharp flat margin, which turned out to be VIA positive. Dense acetowhite at the TZ with raised margin, which is VIA positive. Thin acetowhite located in the TZ with a distinct margin, and this is VIA positive. Large dense acetowhite occupying all 4 quadrants of the cervix and VIA positive. How does VIA suspicious of invasive cancer looks like? Thick, dense, large acetowhite that occupies a large area of the cervix, and the lesion may bleed easily on contact, or it may appear as an exophytic growth. another exophytic growth. Also, this one with the exophytic growth with irregular surface of acetaminoid that is suggestive of cervical cancer. Last item is the follow-up. Among VAA negative, you just do the routine screening, or negative woman may have a screening every 3 to 5 years, but HIV positive women are screened every 1 to 3 years. Among women with VAA test positive, you have two options, either a referral for evaluation for colposcopy or immediate treatment. And if a patient is referred for colposcopy, the option can be either biopsy from the suspected abnormality or an immediate treatment. Immediate treatment is another option, especially in resource-limited setting, provided that the criteria for the treatment by ablation is applicable, which I will discuss on the next slide. The lesion occupies less than 75% of the ectocervix. The SCJ is fully visible. The lesion does not extend to the endocervix or to the vagina, and there is no suspicion of invasive cancer or adenocarcinoma in situ.
We go now to emerging technologies. Shown to you on the slide are the three approaches to standard cervical cancer screening and future tests. Under cytologic or pap smear, future tests include dual staining to identify P16 and Ki67. Just recently, in 2020, artificial intelligence has now shown to improve accuracy using this dual staining, which is P16 and Ki67, in cervical cancer screening. It says here that the researcher found that the AI-based dual staining test had a lower rate of positive tests than both pap cytology and manual dual staining, which, with better sensitivity and substantial higher specificity. AI-based dual stain reduced referral to colposcopy by about a third compared with the PAP. The testing method was also robust, showing comparable performance in anal cytology. You have to remember also, di ba, that ang puwet, pinapap smear na rin, no? So that's why anal cytology for the validation of HPV detection doon sa anal area. Also, meron ng bago ngayon, no? Point of care digital cytology. So, pwede na tong into communities with artificial intelligence for cervical cancer screening in a resource-limited settings. Of course, these are just investigational studies, but papunta na tayo dyan. Of course, when we go to visual inspection, the role of artificial intelligence is on automated visual evaluation of digital images. This means that automatically dapat meron na silang resulta to assist the doctors whether this is via positive, via negative, or suspicious for malignancy. This study, no, that was done by NCI, no, the National Cancer Institute in the US, no, way back in 2019, showed that there is already a computer algorithm, which is ito nga, artificial intelligence, that can accurately outperform even human experts in identifying cervical precancer. So this is our basis. Today, we are now presenting you this machine. This is called Serviray, and this comes from South Korea.
Introducing the world's first AI-based cervical cancer remote reading system, Serviray AI. Serviray AI is composed of hardware that photographs the cervix and that of AI detection and remote diagnosis. By taking a magnified picture of the cervix, our system can detect abnormalities through VIA method. After AI carries out early screening with the image taken by Serviray. Specialists determine the final diagnosis on site or remotely by referring to AI early screening. Through joint research with gynecology oncologists from Korea University Annam Hospital and Seoul National University Bundang Hospital, AI.DOT has developed its own AI algorithm with more than 30,000 IRB approved data. Currently, it also secured the high accuracy of 93% sensitivity and 89% specificity. AI solution for human. AI.DOT.
The on-site screening process begins with you. Begins with you at your clinic, at your maternity, birth, or lying in. You try to take a photo of the cervix. One photo is taken prior the acetic acid, and several photos, 7 photos, will be taken after the acetic acid. Normally, we recommend to you to take it around a minute or 50 seconds after the removal of the acetic acid. And when you take your photos, take it a bit slowly, like 5 seconds apart. Now, once you've taken those photos, you will now be sending it to the doctor for evaluation. Shown to you on the screen is how you are able to take a photo. Hindi ito pinapasok, as you can see on the slide. Now, ang kagandahan nito is that yung AI natutulungan kanyang magpicture, no? Sasabihin niya yan sa'yo kung yan ay hindi cervix o cervix. Sasabihin niya yan sa'yo kung ang kamay mo magalaw o hindi. Kung masyadong maliit yung cervix, ibig sabihin mahaba yung vagina. So, ang sasabihin niya sa'yo, the cervix is small. So, what you need to do is to zoom it. All this will be taught to you during the practicum. While the doctor is reading your images, you also will immediately get within 5 minutes a temporary report based upon the color that it would appear on your screen on the AI survey equipment. Green signifies normal. Yellow will signify somewhat CIN. Orange will reflect somewhat CIN 2 and 3, whereas CIN 3 is suspicious for malignancy, and that will resemble the color red. Once the doctor now is done, she will now forward the report to you through PDF file. And that file is somewhat like this. Here, this patient is a 24-year-old female, wherein her result is P1, that means CIN1. As you understand, women who are below 30 years of age, normally, they have higher risk of HPV infections. And that all the images that you have taken will be shared on that image file, and that a certain mnemonics, morphological analysis is there to guide the doctor. What does A mean? What does N mean? And everything is there. Furthermore, a final result will be marked on the report, and other findings such as cervical polyps or the presence of leukoplakia and condyloma shall be indicated. Again, P1 resembles CIN1 or the yellow. P2 resembles that of the orange or CIN2 or 3, whereas P3 resembles CIN3 or suspicious for malignancy. And this is the last part of the report, and it talks about the cervical cancer screening and the lifestyle habits to prevent cervical cancer.